And we are live. Thank you so much for joining this episode of the Dubb Action Online Summit. Today we have Dr. Priyanka with us, and we are going to be talking about all things artificial intelligence. I wore my NASA shirt. If that means AI, I'm not sure. Hopefully it does.
Close to it.
But the thing that's amazing about AI is that it's going to change every aspect of our existence, starting with healthcare, going to sales and marketing, and the way that we live our lives, solving our problems, helping us to evolve, being better, healthier, happier individuals, bringing hopefully peace on earth. I remain optimistic. Dr. Priyanka, if you could start with the quick intro, and then let's get into this topic.
Sure. Thank you for having me. And my name is Dr. Priyanka Mathur. I'm a trained physician, and I have worked in 3 countries, India, Russia, and United States. And with exposure to these 3 countries' healthcare system, I was able, fortunately, to experience the different systems. And unfortunately, I was able to see the dark side of each system, or I would say the broken side of each system. And then in our conversation, we would discuss about how I would try to bring Medipocket to fill those broken pieces and make the system efficient.
So what would you say the biggest opportunity for artificial intelligence is for humanity as we know it?
So artificial intelligence, as we were saying, it's intelligent. First of all, I always say, don't focus on the artificial part, but the intelligence. So it's intelligent technology that is going to help us in many industries, in many aspects. And honestly, healthcare is being a little slower in adopting it. We always comes last in adopting things like that. But AI has been used in the fintech industry, in the edtech industry, and all these industries, e-commerce industry. It has been being used almost like decades now, and we can see the efficiency part of it. Amazon, one of the first adopters of it, and we can see the volume and the magnitude that company has gone is because of the intelligence about the consumers that the company gets. So artificial intelligence is going to affect humanity in many ways, from education to your entertainment. Healthcare is going to be a very big beneficiary of it, considering we as providers, we as doctors are open for it. We adapt to it because, to be honest, we are the most resistant ones when it comes to technology. Even I don't know if you follow the stats, or if you're in the healthcare, back in when the EHR system started a decade or 2 decades back, we were very resistant. We like to write. We can write, the 10 page, but just if you ask us to type few words, and we are like, no. So EHR took, time to get adopted, and now it's the same happening with AI part of it. AI, as I always say, is going to only augment the doctors. It's going to help us because one doctor has X number of time in a day to serve X number of patients. Whereas because artificial intelligence has no physical limitations, it can serve more. The volume served, which is much huge. Also, the limitations, the insights, and all that it's much more efficient with the use of AI. Now, cannot be a standalone system. It has to be used with the doctor as a supervisor to it, but that doesn't mean the doctor have to supervise each and every action of it. So yes, AI is going to revolutionize healthcare in many aspects, starting from the ground zero level, which I call primary care, to the tertiary care, remote patient monitoring, and all those levels.
Now, there's a general sort of resistance that some people have to anything too technology enabled, i.e. artificial intelligence, machine learning, so on and so forth, because there's a fear. There's a fear that what is this technology doing? What are robots capable of? Will my job be replaced? Am I being scammed? Is there some bad actor that's on the other side of this? There are general concerns, and I don't think there's anything wrong with those concerns. I think that people obviously have to do their own research, and technologists have to do their part, and there needs to be a very responsible way to deploy AI, ML, these types of techs into our daily use. But my question for you is, how can we become better at understanding the pros and cons, the potential and the risks of technology as powerful as AI, as technologists, as product developers?
No, definitely. And I call it as an ethical dance of AI.
Mhm.
We are quite early in this AI world, as I say. And the right now the regulations, the regulations are not set properly. The reason is it's evolving at a very, very fast speed. The regulations and criterias set by the authorities that said are not evolving at the fast pace as the AI.
Mm.
So right now most of these, as we call it, the regulations are based on hardware more than the software, because again the people that are setting up the regulations at on that authority levels are not sound enough with the pace that the AI is evolving. So it's really a kind of a balancing that we have to make right now, as we are with the pace we are evolving it, that we need to trust it, but we need to trust it not 100%, which I always say. Talking about healthcare, we have the device, we are providing the platforms, like let's talk about symptom checker, which is what Dr. AI is going to do. Again, this is machine learning, is like it can only learn with time, right? And it understands various factors around you and then collaborate it, and algorithms become smarter over time. But it takes time, right? Let's say in the initial stage when you are trying to use that technology, and if you 100% base your action on it, it could be a little bit too early to 100% do that. So I always say take help of technology, but completely don't leave either your human doctor or your human technician, or in different fields as that. So you have to join them together. You can take the help of the technology in order to help you, or screen your problems,
Mm.
screen it, making that efficient time with your doctor. Again, the time we get with a doctor is 15 minutes. The technology or AI platforms like Symptom Check can help you to screen that, helps the doctor to get the information in a more accurate way from you, so that 15 minutes of the time can be spent particularly in educating patient. Just again on a healthcare basis, quickly, beside AI, how the AI can help in that efficiency is the doctor time is 15 minutes, what we get during the doctor visit. Out of most of that, only 0 to 1 minute is spent for patient education, because again, a physical examination takes 5 minutes. Your Q&A with the doctor takes 5 minutes. Your lab results take another 0 to 1 minute, and then your health record 0 to 1 minute. So literally, the patient education, there's not enough time. And again, the doctor has to serve other patients, so they don't get that. Now, with the help of the technology, what happens is all these elements could be done ahead of your visit. Only remaining is your physical examination, and the remaining time is patient education. What I mean by patient education is the treatment plan. Why we have this treatment plan? What will be the outcome we are looking to achieve from this? What would be our plan B if we don't achieve this? So this is what the patient education, which is very much needed, which help patients to get involved in their care. By the time they get out of the doctor's office or the hospital, with the human brain, only 50% retains. But when you educate them, it becomes more logical understanding. It's like, why am I taking this medication? What is going to do if I don't take it in time, and all that? So again, technology and AIs can help us in that. Also, it will help us in a continuous care. Once we
Mhm.
are out of it, it helps you to keep a track for a patient. Also for a doctor, if you fall short of something, it's going to help you to keep track. Again, all this can be done with no human limitations with AI.
Yeah, that makes sense to me. There's this kind of correlation that I might make here, which is this is a new technology that's AI driven that we announced on Dubb, which is called Kyra, which is a real-time feedback assistant. So what happens is if someone uploads a video, it does an analysis on what they're saying, and
Mm-hmm.
it sort of provides 9 criteria to provide feedback, like repetition, slang, profanity, empathy, so on and so forth. Now, the correlation that I might make here is that this is some sort of a system checker. This is some sort of a means for the user, in this case, to understand how they're communicating, how they can improve, are there issues? And this is all rooted on self-awareness. And I think that one of the things that I think as just humanity as we know it, I think we're going through a renaissance of self-awareness, understanding truly what our challenges are, understanding what other people's challenges are. This is why we hear terms like authenticity. This is why we hear terms like empathy or compassion in our daily flow in business. Whether we're talking about branding or sales or marketing or healthcare, people are looking for this ability to connect with others and their struggle specifically. So knowing that we're all going through this resurgence of self-awareness, what are some of the things that you might recommend for people to become more self-aware with when it comes to health?
Very important. I think in the healthcare, patients get a lot of, I would say, not blindsided, but they get too overwhelmed. They feel like healthcare information is too much for them to be taken. Why? Because it is presented in a very complex way. EHR systems, which is PHR, you get the portal access to all these EHR systems. Everybody has their own patient access. Again, the information there is medically designed for medically educated people, which is doctors and nurses. It's too much for a lay person. So self-awareness is like to know what is going with my treatment, what is done in the past with with me, and why is this happening now, or what would be the future effect, has to be laid out in a more layman term. It's like where they can understand. When you understand something, you are more involved in it, which is you're more self-aware about it. You can make better decision about it. So sometimes too much anxiety because you're just not understanding it or you're not aware about it creates anxiety, and it actually creates, I also call it, it makes it expensive. Why? Because you'll be rushing every time either to urgent care or to the doctor visit. And what does that do? It costs you time and it costs you money. So self-awareness is not going to only help you in saving your, as I say, saving your own health and your family's health, but it will also help in saving the cost and the time. And it can only happen is when you get involved in something. You have a clear picture what was done in the past, what is getting done in the present, and what would be the future effect, or what would be the future plan for it. So that is very, very important in healthcare. And again, correlating to our current condition, which is COVID-19, a lot of people were very, very anxious or very, is because the criteria given by CDC is like, okay, this certain age of the people are more prospective to get this or this COVID. So, the older people were locked and all that. But as we've seen in some countries, it wasn't the age related. It's related to your health condition. A young person could get it too if his health conditions or if his health parameters related to his past history, family history, is something that make him more like, susceptible to get that. So again, all this would have been easier if they were known about their health information. They could have made a better decision. Should I be meeting my family or should my elder parents or not? Because too much restrictions were done. And as we have seen, when it was too much restricted without any clear understanding of it, what happened is when a little, as I say, a little opening was given, people were just rushed out. And we saw what happened when LA started opening back in, I think it was in June, when they gave a little relaxation to us, the number shooted again. So it's like, because people were like, okay, so again, healthcare the information self-awareness will help in the things like that, because again, unfortunately to tell, not to scare people, but this is not the last pandemic we are seeing. Or this would be the last one. So we need to be equipped. We need to be prepared that next time, if anything like this comes, we are at least well equipped. We can handle it better with less destruction.
Right. Well, and I think we also need to probably watch more TED Talks, because I think in those TED Talks, a lot of the future is described. What I'm referring to is Bill Gates' famous TED Talk on a pandemic, basically.
Exactly.
Two or 3 years prior. So another question for you is, right now, there's this idea of preventative healthcare. There's this idea of self-awareness. There's this idea of investing into myself. There's this idea of accruing debt, right? Debt can be for our health, it can be for our bank account, it can be for our technology. Debt can manifest itself in many ways. How can we start paying off some of our debt when it comes to our health, when it comes to our self-awareness, so that we can ultimately evolve, so that we can ultimately become happier, healthier, more productive individuals?
That's actually a very nice perspective that you put together these four, few elements. And I would say, look in your past.
Mm.
The future, we don't know. Future is all based on what in the past or in the present is. And that is how you can predict the future. But past is already done. So it's solid. It's, there cannot be maybe or yes or no in the past options, right? Because the past has happened and it is what happened. So I always say, go look back in your past history of your health. In case of the health, how you can be self-aware and the preventative part to it, or how you can reduce your debts, is go back, look in your past histories, your family history. That will give you a lot of indications how you should be acting in the present, health wise, what you should be acting, and what you should be looking in the future, what you should be more aware about. So a lot of hints, indications are there with you. The only thing is, as a patient, we don't have access to it. Or sometimes, again, we feel overwhelmed in looking at it. Again, fear of anxiety is there, that it could be, it could be too much, or I would see something which will make my present, I would be more depressed if there's, whatever the history, chronic history of kind of some major illnesses, or I would say the scary illnesses, as I call it, is there. But I always say, no, you have to be open to go back and look in your past, and that will help you to be self-aware for your present and make the plans for your future. So that would combine the three elements that you were saying about the debt, the health debt, your preventative care, and your self-awareness.
Mm-hmm. And I think the two most important questions when it comes to self-awareness with respect to this is, number one is, what was I born with? And number two is, what choices do I make? Because by answering these two questions, I think what we allow ourselves to do is to understand our genetic makeup, to understand traumas that we've gone through, limiting beliefs that we have. When I stress, I eat too much. When I work too hard, I don't do my exercise. When a doctor tells me to take medicine, I don't take it because I have trust issues or I'm lazy. And then, of course, the choices that we're making. Like, I'm not going to prioritize my health. I'm not going to prioritize investing into myself. I think that when we ask ourselves these two questions and to really honestly answer them, I think then only can we evolve.
Exactly.
Because too many times we believe that what we're born with is out of our control, which is not the case.
We can always improve. As it said, what you're born with, not just health wise, but overall conditions, wasn't in your control. But how you grow or how you end is in your control. Mean to say, you can always improve things by the efforts you make. Sometimes if you're born with something, it may require more efforts than let's say from the people who are born with less kind of those things. They may need less efforts, but you may need more effort. But again, with the efforts, with self-awareness, that you can always come out of it. So it's really, really important. And one more thing, I think with the things that you mentioned is sometimes we don't keep our health as a priority, which in case as a parent, we don't. Because when you are a parent, you're a business person or you're working, our health always comes down in our list, in our to-do list, which is, literally at the last point. And that is where these technologies are going to help us. They will be helping as an assistant to us, an intelligent assistant, as I call them, which will be reminding you about your health or helping you to stick to some things. For example, adherence to your medications. If I just say, take this medication, and I don't tell you why or what will happen if you skip today and you don't take it, then you will be like, okay, now I understand what the effects could be. These days, right now in the healthcare, it's all about do this, do not do this. But the reasoning of why doctors don't have the time to tell that. Again, with that limited time you get with the doctors, and the healthcare system, which is the institutes, the hospitals, don't want you to know that. Because if you know that, if you're self-aware, you're not going to go there to them as often as you should, as they want you to come. So again, they don't want you to be self-aware. It has to be done by us. And these technologies help that, assist you in that, to make you self-aware and reduce on those visits.
Well, I think that's the ultimate paradox of the healthcare industry, that the healthier people are, the worse off the industry is.
They don't like healthier people.
To oversimplify it. Now you have a startup company, Medipocket. I'd love to learn the problem that you guys are solving.
Mm-hmm. So Medipocket, I started with the reason of me being a healthcare provider and interacting with the patient on a day-to-day basis, and seeing the struggle of a patient. When they come into the system, they are overwhelmed, they're anxious, they just have no clue what's going with that. And so I wanted to create a platform on a ground zero level. And what I mean is a primary care level, because 95% of our interaction is on day-to-day basis is primary care. That's where we interact on a day-to-day basis. And that is where I wanted to be a simplified platform on the surface, but sophisticated platform on the background. So it's intelligent on the background, but on the surface, it looks like the most simplified, which a 10th grader can use it. So it's really important where we can simplify the healthcare in a way where it doesn't feel overwhelming, or it doesn't feel like, oh, you need to be really educated in order to open that platform. So we make it a really simplified, more like a 10th grader can use it, where they can get engaged about their health information. So it is like centralizing the health information in a pocket, and also a screening process, which is more like mimicking a virtual doctor, to help screening your symptoms and giving the recommendations, again, more personalized rather than generalized recommendations.
Mm. And where can people learn more about you? LinkedIn, social platforms, your website?
Yes, so they can visit the Medipocket, mymedipocket.com website. They can download the apps to learn about what we offer. We offer the prescription discount right now, which is free. So they can download our apps on the iOS and the Android Medipocket. They can connect me on LinkedIn. I'm quite active and open for the connections to learn from where people from various industries. They can connect me, Priyanka Mathur, MD, on LinkedIn. And they can also follow us on Facebook on Medipocket, because we are soon coming up with a Dr. AI. We are launching a Dr. AI, which is, we are very proud and we are very excited to bring to the market, which will be a virtual doctor to giving more personalized care. So they can always follow our journey on the Facebook and connect me on LinkedIn.
Amazing. Well, thank you so much for your time. Really appreciate you.
Thank you, Ruben.